head and neck lymphedema. I don't know. It seems I'm hearing more about it, Becky. Is that on the rise?
I hope that you're hearing more about it because I think that hopefully means that we're raising awareness of head and neck lymphedema. The most challenging parts of the body, as you said, I don't think there's necessarily a body part that is the most complex to treat, but I think that things complicate some areas of the body because they have other functions. So head and neck, for example, patients may have had very aggressive cancer treatment and then may have other difficulties with nutrition, with their complex scarring. Maybe they need dentistry support and help. There's so many layers upon these conditions that can make them much more complex to manage. It's not necessarily the part of the body itself that's difficult, although certain areas are easier to compress than others, and certainly certain parts of the body have more challenges. But I'm glad if you're hearing more about head and neck lymphedema, because I do, as I say, I hope that's raising awareness of such an unknown or little known area of the body that's affected. In the same way that a lot of other cancers don't have a direct link through to lymphedema management. So we know that probably the best known of the cancers treated in the UK that can result in lymphedema is breast cancer. But actually, we know that we want to raise awareness of melanomas, where there's a high incidence of lymphedema after lymph node removal, along with female pelvic, male pelvic cancers. And Accelerate has recently developed some online training for cancer-related lymphedema, which is split into an introductory course, which is suitable for everyone. And then there are 5 bolt-on sections, which include breast and arm, head and neck, female pelvic, male pelvic, and skin to cover those areas. And then there's also a palliative or end of life module as well. So I'm really hoping that this will continue to raise awareness. And the training has not been designed for lymphedema practitioners, it's been designed for cancer doctors, nurses, radiographers, radiologists, anybody working with anyone with a cancer journey. And as we know, it's said that 1 in 2 people will get cancer. So a lot of healthcare practitioners will interact with people who've had a diagnosis of cancer. And we really want to upskill them in how they can help people who are at risk of or living with lymphedema as a result of cancer.
You know, in such a challenging topic, your passion, your enthusiasm just comes across in leaps and bounds. And if you weren't busy enough in your career, you decided to join the British Lymphology Society as a trustee. For anyone who's watching, I hope you found it really interesting and informative, and keep your eye out for other videos of this nature on our YouTube channel and our website, LymphUnited or lymphedemaunited.com.